Okay. Well, it's a few minutes after 2, and I know we're going to have a really lively and exciting discussion today, so I'm going to go ahead and get us started. I'm Dr. Erica Trappel, and on behalf of the Prevention Research Center for Healthy Neighborhoods, I'd like to welcome you to our March seminar. In today's seminar, Dr. Elaine Borawski will discuss Freshfinder, which is an interactive map developed by the PRCHN with the goal of assisting local health professionals such as dietitians, social workers, and community health workers to better guide their Cleveland-based patients and clients in finding fresh and healthy foods in their neighborhoods and across the city. The Freshfinder map can also help health professionals better understand their clients' challenges in adopting a healthier diet. The data that feeds the map is derived from the annual food retail data collection conducted each summer by the PRCHN and data from the Greater Cleveland Food Bank, OSU Extension, and the RTA. This interactive presentation will highlight the features of Freshfinder and also discuss the impact of COVID-19 on the local retail food environment. If you are not connected with us, we'd love for you to take a minute to do so. You can find us on the web at www.prchn.org. Follow us at our social on the right-hand side. And if you'd like to tweet or post to your social today, always feel free to use hashtag PRCHN seminar. We always like to take a moment at the beginning and the end of our seminar to highlight our next month's speaker. And I am thrilled to host Dr. Craig Fryer, who's a friend and colleague, next month in our April seminar, who will be discussing moving beyond symbolic gestures, the respectful engagement of underserved communities in research. We will put the registration link in the chat now and remind you again at the end of our seminar in case you'd like to register now for next month's seminar. As we've shared with you before, for the last 2 years, we've been doing our seminars virtually, and we really all miss that opportunity to engage. So we ask you to take a moment right now to please add your name and organization to the chat box and introduce yourself to others that are joining the call today. This is just a little bit of an opportunity to catch up on some of that networking that we miss. We also encourage you to use the chat feature throughout the presentation to ask questions. I will be a moderator for this and help moderate those questions in the chat box as we move through our presentation today. We'll also offer you to unmute yourself if you'd like to ask your questions in person. It's now my honor to introduce my friend and colleague, Dr. Elaine Borawski. Dr. Borawski is a medical sociologist interested in the social and environmental influences of health and health behavior and the development of testing of new intervention strategies that draw from the strengths of the environments and the people who live within them. Throughout her career, Dr. Borawski has worked closely with local stakeholders on a wide range of issues, including childhood obesity, healthy food access, HIV, pregnancy prevention, and tobacco prevention and control. Within the Department of Nutrition, Dr. Borawski serves as the Vice Chair for Applied Research, a new position that aims to increase the portfolio and visibility of community and public health nutrition research within the department and across the School of Medicine. Additionally, she currently serves as the faculty lead for the Community and Collaboration component for Cleveland's Clinical and Translational Science Collaborative. In this role, she and her team are developing models and methods for ensuring integration of community and stakeholder engagement as part of the CTSC's promotion of interdisciplinary team development and team science across the university and healthcare system partners. They also work closely with a large number of community-based collaboratives that involve both academic and community partners focused on addressing a specific population health issue, such as access to care, infant mortality, or tobacco cessation, with the goal of establishing and disseminating best practices. So it's my honor to go ahead and turn the floor over to Dr. Borawski for this wonderful presentation. And you're on mute.
Thank you. Okay, let me go ahead and share. Sorry. And you're going to see a glimpse of something, but we're going to come back to it. Okay, Erica, just let me make sure that you see the map currently, right?
Correct.
Okay. Okay, now we're good?
Wonderful.
All right. Good afternoon, everybody. It's really a great pleasure to be here and to share some updates from our PRC's NEAT project. I just want to apologize. I do look like I'm an air traffic controller, but my audio is not working, so forgive the headphones. So basically, we're going to give today's talk is going to have two parts to it, but I am going to switch it around a little bit. We wanted to, obviously, we're going to share our new tool that we have developed called Freshfinder. And that's probably why most of you are here, but we also have some findings from our recent analysis of the food retail in Cleveland from 2019 to 2021, sort of pre-pandemic to in the middle of pandemic. And we wanted to share some of that data. And I'm going to share some of that earlier, because I think once we get to the Freshfinder interactive stage, that could probably take the rest of the time. So thank you all for being here. Thank you, PRC, for hosting this talk. So before I start, I really want to acknowledge the many people that have worked on NEEP and specifically on the Food and Tobacco Retail Project, and the team that was really responsible for Freshfinder becoming a reality. So first, as I'll describe a little bit later, Freshfinder was made possible through a grant through the Friedman Center for Digital Scholarship here at CASE. And through this funding, it was allowed us to bring GIS expertise to the table, which included Matthew Kukmanik and Ben Gorman from the Friedman Center, and also the nutrition expertise from Marie Bazil Davidson, who really helped us pilot the Freshfinder. But none of this would be possible if it weren't for the longstanding commitment of the PRC and our other funders to this annual food and tobacco data collection and the hard work it takes of pulling these data together into a comprehensive, really usable data set. And so I'd like to formally acknowledge Laura Fernandez and Lauren Barato, who are our current keepers of the data. And to Rachel Gardenhire, I'm sure you're on, who really dedicated a good part of 2 years of her life of really creating the foundation on which this work is now built. And of course, to Erica Trappel, who was responsible for actually initiating this project back in 2012, and who continues to support it today as director of the center. So thank you. Okay, so as I said, I'm going to go over a little bit of the background of this, because I know some of you, many of you probably know it very well. Some of you may be just learning about this from the first time. So we'll spend a little bit of time on background. So NEEP was an overall initiative called the Neighborhood Environment Assessment Project. And we launched it back in 2009 as a part of the original first cycle of funding from the CDC. And the goal of it was for us to get a better understanding of the built environment or the environmental landscape of Cleveland so that we could provide data back to community partners and researchers alike. And over the years, NEEP did a lot of different environmental assessments from this particular project, but we also assessed parks and playgrounds and water fountains and community gardens and farmers markets. But our longest running project within NEEP has been this Cleveland Food and Tobacco Retail Project, which was started in 2012. And so this project basically involves an annual ground truthing and in-store assessment process that happens every summer in all retail outlets across Cleveland that sell food. So this can include grocery stores, corner stores, convenience stores, gas stations, all the dollar stores, specialty food stores, fast food outlets, restaurants, bars, lounges, anything that we think has that sells food is what became part of this database. And each summer, we basically employ a small army of interns who fan out across the city. Most are students, either here in Cleveland or across the country. And with this audit tool that we use, they go into each one of these stores each summer. And so the audit tool itself captures about 25 specific food items with a really specific interest in things that we know are important to nutrition assistance programs like WIC and SNAP. But it also does capture a lot of other information around food characteristics and whether they have prepared foods. And then there's a whole section on tobacco availability and advertising that Erica could tell you a lot more, but that we won't talk about today, but is also in this data set. So we often joke about the small army that we send out, but it's really not a joke. Here are just a few pictures of the great teams of interns that we've had over the summer who literally come together. They go out in teams of 2 and 3 and traverse the entire city. So we could not have done this project for all these years without all these wonderful folks that have joined us. Okay, so initially the project started out, we started out with a master list from basically a local vendor. But then literally the students started back in 2012, really to 2014 or so, really driving up and down the streets of Cleveland and us making sure that we had all the locations that we that we could find on every street. And then over the years, then we have used that list. So this list is really well culled now. We go back to the same ones and we continue to do this ground truthing. And so the students basically are given maps that look like this one. Here's one for Broadway Slavic Village. You can see the dots that tell you where we've had a previously identified outlet. And this is just one of 34 of these maps that the interns take and come back with information both about the current status of these locations, whether their name has changed, whether they're open or they're closed, and any other new information, and specifically also any other new stores or outlets that they see. And then this is the actual assessment that takes place. So this is a form front and back. They go in basically 2 to 3 and document everything that they see. So they count fruits and vegetables, they count, they give some pricing. And I'm just thinking, I don't think I have, this is on our website. I'm sorry, I don't think I have this as to put in the chat, but we could share this if folks really wanted to see it. But as you can see, this is the data that's collected. And then we send them out into the field. And the students basically go into each store with this form. And the beauty of this is, I think at the beginning, vendor or the store owners across the city were a little nervous, I think, about our students coming in. But these days, what we hear from the students is that, you know, they know most stores know they're coming and they welcome them. And it turns out to be an incredibly important experience for our interns. A lot of students are public health students, nutrition students, students that may or may not be from Cleveland, but may have never been exposed or really been into the hearts of Cleveland's neighborhoods. And I will tell you, I think Erica can share it with you too, is that the experience is unmatchable for a lot of students. I think some students come out of this with just a very different view of the world and what they want to do with their careers. Okay, so from these data, for about 7 years, our data stood alone as every year of data collection. And so that's how we kept it. And then in 2017, we took the undertaking then of creating a longitudinal database. And so this resulted in this single longitudinal place-based data database that captures everything from 2012 to 2021. The only data year that we're missing is 2020 due to COVID. And then, so what this means is that every address that has ever been recorded as selling food or tobacco products now has a running record of all of our assessment data over the years. So it captures the geolocations, the store openings and closures, changes in store names or ownership, and just all the different characteristics of what we're looking for in those stores. Okay, so next. So from all this data, we needed to make sense of it. And so we created a classification system, a store classification system that really would allow us to kind of look at these stores over time, not only to be able to describe the landscape of Cleveland, but also to be able to give us a little bit of an evaluative tool. And you'll see in a bit what I mean by this, is that there was a lot of work going on, and there continues to go on at the PRC through the REACH program, where, you know, working with small corner stores to move them into being able to provide more staples and become perhaps a small grocery store. This system then allows us to collect that data. And so, Laura, can you go ahead and add this to the chat? So Laura's going to add the PDF of this if you'd like to see this. It's not very easy to see, I think, on the screen. I am going to take it piece by piece, but this was a data brief that Rachel Gardenhire created to summarize how our classification system works. Okay, all right. Because I can't see everybody, I'm assuming that happened. All right, I'm going to keep going.
It's posted. Okay,
thank you. All right, I got too much on my screens here. All right, so let's take it through one at a time then. So the first at the very highest level, and as you're going to see on the far left of the screen here, as we move down, it means the availability of healthy staple foods become fewer and fewer. So at the top of the list is our full service supermarkets, right? These are the ones that sell not necessarily deli meat, but raw fresh meat. They sell chicken and beef and et cetera. They have to have an indoor in-store bakery, and then they must sell all of the following products that you see here. So eggs, whole wheat, whole grain bread, dried beans, 1% or 2%, or sorry, skim milk, let's just say that. And then 6 or more varieties of fresh fruit, fresh vegetables, processed or canned fruit, and processed or canned vegetables. Okay, so a supermarket then carries all of these. And so obviously examples of supermarkets in Cleveland are these that we know: Heinen's, Giant Eagle, Dave's. And just so you know that, but there are only 14 of these across the city. And so here's a picture or a map of where these stores currently are as they spread out. Now you look at this, you think, well, they're pretty well spread out. There is a pretty good, at least it seems like everybody should have access. But as you take, just to get a perspective, especially for those of you who aren't from Cleveland, the distance from basically down here by Hopkins Airport straight across all the way to North Collinwood is 26 miles. And that becomes important when you consider that 25% of Cleveland adults do not have access to a car, not only do not own one or have access. So if you live here, if you live basically here, it's still pretty far to these larger grocery stores. So then you go to the next level of grocery stores, and that's what we call the large grocery. And typically what it means is they either don't have both, they don't sell both raw meat and have a bakery. That's what kicks them out sometimes. But also, in order to be a large grocery, you only have to carry 3 of the following. So 3 of the fresh fruit, fresh vegetables, processed and processed vegetables. But they still must sell all of the following. So must sell eggs, bread, dried beans, and 2 or more varieties of milk. Okay. And so these are the stores currently that we consider large groceries. So these are the Aldi's, the Save-A-Lots, right? They carry most products, but they might not have that bakery and that, lots of fresh meat and things of that nature. And currently there are 29 of these stores across the city. And here's the map that shows you where these are. Okay. The third level is a small grocery. And these next 2 levels are probably the ones that are the most important to us at the PRC, because as you'll see, these are the stores that many people have access to. Now, a small grocery doesn't meet the other characteristics, but it must at least carry 1 or more varieties of the fresh fruit and vegetables and the processed fruit and vegetables. And it has to carry at least 2 of the eggs, bread, dried beans, must have at least 1 variety of milk, and carry raw meat. So in order to be a small grocer, you have to meet all of these characteristics. Now, these are pictures of what we would call small groceries. And as you'll see, a lot more of these. There's 53 of these, and were in 2021. And some of these, you look at them, you think, okay, I can see those are convenience stores and that. But some of them, I think, just so everybody can see, is that you might not always think about what they might have. This is a store that's in the Asiatown area, on St. Clair and Superior area. And from the outside, you might not think too much about what's in it, but yet it has significant fruits and vegetables and quite a bit of food. So what you see, you might not necessarily know what's inside. Similar, here's another store, and I want to point this one out because this looks great. It looks like it has, from the outside, you might not think it carries all of these things, but part of the reason why it does is because it is a part of this program that is near and dear to our heart here at the PRC, which is the Good Food Here Now, which is the development Morgan Taggart and Bree and a number of folks and Erica have been working on. Okay, and here, as you can start to see, there's more small groceries. But then the last stage. So this is the corner stores and convenience stores that sell food products, but they don't meet any of those above characteristics. So they don't sell at least 1 of these, right? So they don't have the fresh fruits, and they don't sell at least 2 of these. And that's what makes them fall into this category. Now, what is striking, and here are some examples of corner stores and convenience stores. But to know, though, that some of these convenience stores, like the large box stores, they may still be considered a small or large grocery. It just depends on what things they carry, okay? And this is probably what's most overwhelming, is that this is our current, there are 472 corner and convenience stores in Cleveland. Okay. All right. I'm just going to quickly go through this just so you can see this. We do collect data on all prepared food outlets. So that's including restaurants and takeout. There's two basic categories of fast food and restaurants. And this gives you a glimpse of where these are across the city. And I think if you can think of those corner stores and you can think of all this fast food in comparison to the 14, 29, 53 smaller stores that actually sell staples, this is more overwhelmingly probably not the healthiest food available. Okay, so I'm going to pause there. I know I've been talking fast and I just want to make sure I've got time to do all this. So the first thing we wanted to do is just give a little bit of an update on some of the data. So remember, we had 2019, we collected data. We do it every summer. Lo and behold, 2020 comes, we had to cancel that data collection because of COVID. But we were lucky last summer to get back into the stores and do a second round. But that was still part of the pandemic. And so what we're going to show you is what happened to these stores over those 2 years. And then hopefully know that you need to come back soon, is that we'll be collecting again data in 2022, where we'll really hopefully be able to see somewhat of a pre and post pandemic impact. So here is the distributions of the different types of stores from 2015 to 2021. And you'll notice 2017 is missing. Data collection protocol was somewhat different and it doesn't align. So we've just taken it out so you can see the trajectory. And what you'll see is that across the board, there has been a decline over the last, not only from 15 to 21, but even from the distance in the changes from 19 to 21, but across over time. And you'll see there's been significant drops throughout. And so I'm going to take it like just one sketch at a time. So if you look at 2019, we had 13 supermarkets at that time, 36 large groceries, 50 small groceries, and 510 corner and convenience stores. In 2021, here's what happened to each one of those sections. You'll see they kind of some exchange places. So we gained a grocery store. So in 2021, we actually have now 14, but that is actually the number we had back in 2015. So that has sort of stayed stable. In terms of the large grocery, then we did lose 8 of them became small groceries. One of them actually went up to being a large to a supermarket. Similarly here, you can see of those 50 small groceries, 3 of them actually improved, but 16 of them downgraded to a corner store, which means they had to have lost the availability of the foods, right, that we collect, and one was temporarily closed. And of the corner stores is really where you see the dramatic drop. And in some of these neighborhoods where these are the primary places that people shop, this becomes more problematic. It is true that 15 of those went up to being considered a small grocery, but 11 of them were coded then as no longer having food, no longer really classifying as a part of our food retail. 16 were temporarily closed, 25 were permanently closed. So if you look at the change overall, there were significant changes in all of them. I mean, it's all based on the total, but for the most part, as you can see, the changes were more negative than positive. And so from this, we wanted to at least look to see, well, where did this happen and what impact did it have on the city? And so before we go into this, I just want to make sure for those of you who are not from Cleveland to give you a little bit of an orientation. So this is a map of Cleveland in the green. These are all the neighborhoods. And for those of you know, this is the Cuyahoga River, which basically splits our city in half from the east side to the west side. But I think it gives a little bit of helpful orientation when you see the changes that happened. And so this is a net loss gain. This is all food retail. So basically I took supermarkets, large groceries, small groceries, and corner and said, how many did they have in 2019? How many do they have in 2021? And what's the net gain? And what you can see here is that in the 15 neighborhoods on the west side, which is this, 5 of them had either a gain or had no change. And then 10 had a net loss. with Cam's Corner getting hit the hardest on the west side with a net loss of 7 stores. But then you compare it to the east side stores, and you can see that the east side neighborhoods were hit far harder. Of the 18 east side neighborhoods, only 2 of them had a net gain of 0 or 1, while the remaining 16 had losses, and some of them quite significantly. Slavic Village had a net loss of 18 stores, Glenville 17 stores, Union Miles 10 stores, and Mount Pleasant 9 stores. So I'll just leave this up for a little bit for you to see. Sorry, I'm looking at my screen, but not what you're seeing. So everybody can see that the below line means losses. The above line is positive, right? And so you can see here, Slavic Village losing 18, 17, 9, and 10. And here's Cam's Corner. And so if I go back up again, just to, oh, actually, I think, Laura, I think you did this for me already, didn't you? Oh, I wanted to first mention too that, but it's not because there are just way more stores on the east side to close. There's not that much of a difference. There are a total of 277 of these stores on the east side and 266 on the west side. So these are real losses in terms of what's available. And so here you can see those same net losses put into perspective of the actual neighborhoods. And so those ones that I told you about where you have losses of 16 to 20, here's Broadview Slavic Village. Remember here, this is the Cuyahoga, sorry, wrong screen. This is the Cuyahoga River here. So Slavic Village, Glenville. And then the only gains then are the gains are the ones that are in purple and the light blue. So you can see that the east side really has taken a hit, and we'll have to see what happens with the 222 data to see if there was restoration of these. A number of them, again, were either permanently or temporarily closed, and what we would hope is that they would reopen by this summer. Okay, due to time, I think I'm going to skip past this. We have done this. We have been starting to look now to see, well, the stores changed, but what about the healthy food that's available in the stores? And I'm going to, sorry, I think I'm going to pass. I'll come back to this if I have time. Okay. So in terms of the summary of what we've seen, it does look like the food retail landscape, if you look from 15 to 21, the food retail landscape with regard to supermarkets and large groceries has not really changed dramatically in the last 9 years. We know that there are a number of new stores planned that we know, like around, there's the new one coming around the clinic, the Myers and things of that nature. So it's hard to know, but at this point, there's been virtually no change at the high end level. There has been an increase in corner and convenience stores that have become small groceries in our classification system. So I think what we would like to look at in really talking with Bree and Morgan is that, are these examples of evidence of intervention effects, right? So looking at the stores that we've seen document, are these in fact the stores that have been a part of the interventions that have taken place over the last 7 to 8 years? And it does look like the east side neighborhoods of Cleveland have really been hit the hardest by COVID. And only time will tell if they then reopen by 2022. We are in a process. Oops, sorry. Yes.
I got a quick question that asked
Yes.
if you might be able to briefly comment on the population in those neighborhoods in East and West, just for those who may be less familiar with the city.
Yes, sure. Let me see if I can go back here. Sorry. And can you see that map now?
Yes.
Okay, so I think if most know that if any of you know the redlining maps, I think you'd see that this kind of parallels the redlining maps as well. And so on the east side, I should say, like right here is where the university is, right? So Cases is right here. So predominantly the neighborhoods that I'm circling now are predominantly African-American, all the way up through here. I'd say probably it could be anywhere between, I don't really want to say for sure, but predominantly African-American. And then once you get to Broadview, Slavic Village is more of a mix. As you move to the west, everybody, that if you're on the near west side, so this is now crossing the river, Tremont, Ohio City, where Clark-Fulton, where Metro is, you have a larger Latino, Hispanic population here. Then once you move towards out here, this is more of a predominantly, white population. The income level is probably the highest in the far west side of Cleveland, but please know that Cleveland's, the average income is across the city of Cleveland is under 60,000. It's about 56,000, I think, right now. So it's, the income level is pretty, pretty stable across. I would say probably the lowest income neighborhoods are in these yellow spaces. And that's why you'll see why when we get to the map that I show you, you begin to see when people live in these neighborhoods and there's virtually nothing there to go to, and you don't have a car, it becomes problematic. So I don't know, I can't see anybody, so I'm sorry if let me see. There we go.
Elaine.
Is there does that answer the question?
Well, there was a clarification. So I
Okay.
think that's helpful for part one. And then the second was, I don't know if you have data on population loss that may be associated with, right, with store closure.
With store closure, yeah. I would say yes for the overall, especially, you're right. I mean, over the last, since 2008 and 9, since the recession, this area of the east side of Cleveland, has really been devastated. If you go through the neighborhoods, you'll now see, you can see blocks of blocks with maybe there are only a handful of houses. So yes, there's less population, and so less folks to utilize the stores. But there's also an awful lot of work going on, like in these neighborhoods around Central with the Burton Bell Carr and these other community development corporations that are also rebuilding. So I'm not sure I'm answering the question, but I'm probably not the right person to answer it either. I don't know if that's enough.
Thanks, Elaine.
That's okay. All right. All right. We can come back when I can see everybody. Hopefully we can continue that set of questions. Okay. So let's move in. What I would love to hear, what you're just telling us right now, I would also love to hear what you all would love to see out of this data. We have it in good shape now. We can work with folks if they'd like to work with the data with us. We can, if you would like some things out of it, we have a request form that we can provide data that you might like out of it. So let's hopefully at the end, we'll have some time to do that. You can always add it to the chat. That would be helpful too. Okay, so this is why you all came. So we're going to introduce you to this Freshfinder interactive map. So just to give you a quick background again, the goal of this was then to take all this data from the food and tobacco database and put it into an accessible, user-friendly platform that we thought researchers and community partners alike could use. And we especially wanted to focus on health professionals who are working with food insecure Clevelanders, especially dietitians and community health workers, with a twofold purpose. One was, I mean, as a number of people have pointed out, and we agree from the beginning, this really isn't to help residents know where their food is. They know where food is in the neighborhood. But when someone's trying to help them change diet or do shopping or dietary planning, I think people have a lot of assumptions of what's available. And so what we hope is it will help in that process of if you're sitting as a dietitian sitting down with somebody and helping them put together a diabetic food plan. Now you can actually look to see what's literally, if they don't have a car, what's walkable to them? What actually do they have inaccessible in their neighborhood? And so as a part of that, we're hoping that it also increases awareness of dietitians and others that use it to really understand the challenges that many Clevelanders are faced with in terms of trying to access healthy foods in their own neighborhood if they don't have access to transportation. And so we were very grateful to the Friedman Center for Digital Scholarship for providing us support to be able to put this map together. We built the team, as I mentioned. Matthew Kukmanik is on. I hope Marie Bazil Davidson is not here. I think she is doing her internship at the Cleveland Clinic now, and Dr. Ben Gorman, who is from the Friedman Center, who really, these guys built this map. We would meet every week until we built the prototype. And then Marie and I piloted it with a number of local dietitians. That was incredibly informative. It allowed us to really fine tune the visuals, how to orient the map. I was just going to say, Matthew can tell you that we talked for hours about what color icons ought to be. But then we were also able to add, with the collaboration with the Food Bank and Ohio Extension and RTA, we were able to add farmers markets and food pantries and bus stops onto the map as well. And then our last phase has been that we've started adding suburban chain restaurant or supermarkets and large groceries to the map, so that if somebody lives on a bus line that may take them out of the city, but yet there is a Giant Eagle or something close on that, then they would be able to access those as well. But we do not include the small store based on audits. Okay, so this is the map. I'm going to ask now for Laura is going to put the link in the chat. Thank you, Laura. Okay. And so for some of you, you might want to follow along with me. Others of you may want to, especially if you have two screens, but if not, you can pull it up. You can play with it while listening. But I'm going to walk you through this map and orient you, and then we'll see where we go with it. Okay. So the first thing I want to show you is in the top right corner of this map, there are a number of icons, and we'll go through each one of them once we go interactive. But these are key to everything that you can find on the map. The second thing is that I want to point out is that every time you click on a map, another screen will pull up over here. So that's the point of that. And then the last thing is that there is some wealth of information at the bottom here. Ree built a really lovely video tutorial that you can take time later if you would like to, and it walks you through how to use the map. It is being updated because the map that video was based on was the 2019 data, and we now have the 2021 data in. Okay, so now I'm going to access this so you can see it. Okay. All right. So Erica, can you just give me a thumbs up that you can see the map?
Yep, you're good to
Okay,
go.
thank you. Okay. All right, everybody. So I'm going to switch my screen so I can walk you through this. So, and feel free, I'm going to try to talk through some things, but we can maybe pause and then if anybody gets stuck. But let me just show you the highlights of the map first. So when you open up the map, you automatically have this information sheet. And basically it's telling you right now, the map's empty. So in order to build the map, you have to go to the layers icon up here. So we did this on purpose because when we first started it, the map was fully populated. And when we showed it to the dietitians, it was just overwhelming. And so we start with an empty map, and that way it leaves it up to you to build what you want to see on the map. All right. And so in order to do that, you go up to the top icon and click on the layers, and you get this layer list that, as you can see, that are all empty. And so I'm just going to take the ones that I think we'll want to work with this morning or this afternoon. I'm going to take, so the green gives you the supermarkets. Blue is large grocery stores. Red is our small grocery stores, if you're remembering the classification. And now once you put the corner stores, it just gets very busy. All right, but we're going to leave it that way for now. You can, if you want, click on the WIC and SNAP if you want, but for the most part, you're going to see that most of these stores, especially if they are one of these, all take WIC and SNAP. And I'm going to show you in a minute. Well, I can show you right now. If you click on any one of these, a little box comes up, and in that box, it'll tell you everything, including whether they accept SNAP or WIC. So you can either look at it by icon if you just wanted to see where those stores are, but then inside of each store, it tells you the name of the store, the location, what store type it is based on our classification. And then it tells you all the things that were on that sheet. So you'll know, like, does it carry all of these products? How many of those fruits and vegetables does it carry? Does it have prepared foods? Every one of these, from the small groceries to even the, sorry, if I put the corner stores on, even the corner stores have this. And like you can see, sometimes there's no data collected on it. So that was not a good one to pick up. Okay. You can also then add farmers markets, which are these cute little carrots. And then there's also, and this gets very busy, but these are also the food pantries as well as the mobile pantries supported by the food bank. And so I think when we start to dive in, I'm going to leave all these on for a moment. The last thing, which is extremely overwhelming first, these are the RTA lines. So that tells you where the bus and train lines are. And just hang on to your hats here. Once you put the stops in, they're everywhere. Okay, so you can leave them on or take them off. Let's take them off for right now. Okay, so before I go on to this, up atop here, just want to point out that if you click on the shopping, the little shopping, it gives you that classification. Again, if you need to remember what was green, right? So the green is the large, and they get, they get smaller as they go down. This tells you what they carry, okay? And you can also click here for that PDF that we mentioned before. Okay, we'll come back to the rest of this. Let's go back now. And I'm going to now switch you, shut this off, put this here. And now I'm going to move you over to the left side of the screen. So this is basically the tool that you would use if you want to look at a specific location. And so you can either put an address in this bar, okay? Or you can literally, if you know an address, if you have a client in front of you and you just plug in their address, something will pop up, same thing. Or you can click here and literally just drop drop the pin into somewhere in the map. So let's just say we'll go right here. Okay. So regardless of whether I had put this address in, right? Hang on, sorry. Here we go. There we go. Okay. You can then, wherever I either put the pin or I could put this address, it gives you then, in this case, these are all the results that are within 1/2 mile from this person's home. Okay. You can also change it to be, you can go to 1 mile, right? And it just widens it. So let's stay here for 1 mile because this is a pretty good example. So this person lives here. There are a number of things, as you can see. And but if you first thought, okay, where's the largest grocery store? These are the two. They are outside their circle, right? So this is a 1 mile radius, right? And so sorry, make sure I'm getting this right. 1 mile. Oh my, I just have a realization. I don't remember now if this is a 1 mile radius or 1 mile from the home. I'll ask Matthew to tell me that. And when he comes, we'll get Matthew to put it in the chat if you could, Matt. Is this radius a 1 mile from the home, or is it the entire radius of the circle? Okay, so hopefully Matt will hear me and do that. All right, so here's where you would have the opportunity now. So you're looking, you're thinking, okay, this person doesn't have a car and this is where they live. And I look over here and it tells me basically is that there's basically one large grocery, right? Which is the blue, and that's this one here, right? Which is an Aldi's. So there is an Aldi's close by. There are 2 grocery stores, 2 small groceries, which are the 2 red. And then there are a number of corner stores, 11, and then the food pantries. But by doing this, you could then go in, and if you know that this individual, you're trying, let's say it's a diabetic, and you're trying to look at more fruits and vegetables or looking at the carbohydrates, you should be able to see what they potentially could purchase at these stores. And so, and it also will help you tell what it doesn't have. And I think that's maybe more crucial. Just recently, we have added infant formula to the maps as well. And we are open to other things. If there are things that are in the stores that folks would like to see us collect, I think we could probably do that. Once you're in this place, you also then have the option of being able to, let me see if I get this right. Sorry, let me go back here. And if you clicked on so now you know where the routes are. So this person's here. Then if they wanted to get up to this grocery store here or to this Aldi's, you can see the bus routes. So if you click on the route, it tells you this one is route 11. This one is route 2. If you actually click on it and go on to the where it says more info, it takes you right to the RTA and will tell you then where this route goes, right? And I know, and folks that are RTA users will know much more about how and which to use this. But it should be able to be something, if you're sitting down with somebody, to really help them navigate where. But I think having this information would help you to be able to build what exactly is accessible. And so if you really are asking this individual, for example, to have many fruits and vegetables every week, you are going to need to think through how they might access this if they don't have a car and don't have access to a car. And in fact, they're going to be purchasing things from, let's do it this one, from this small little, well, that's a liquor store, but it must sell a little bit of food, which is why it's there. Oops, sorry. Okay. Or they might, I'm just trying to think the things that would be, if you could walk, here's another one. So Woodland Supermarket in Valero on Woodland. All right. And so, you know, looking at this one, it does take SNAP, it takes WIC, right? It carries eggs and milk. It doesn't carry skim or low fat, but it does carries milk. It doesn't carry whole wheat food, whole wheat bread. So this is a good example where this corner store has food, it does carry, but it doesn't carry a lot of the things that we would consider on a more healthier diet. Similarly, it does have canned or frozen vegetables, but as you notice here, it has no fresh vegetables. Okay, I am going to stop there because I think that this was really more to just, let me make sure. We're going to open it up to questions, but before I do that, let me, time-wise. Yeah, just to tell you real quickly, and then we'll come back to the opening questions. I really want to hear everybody's feedback. Is that the cool thing about this now is that we are already putting this into use. There's a project called Nourishing Beginnings that is a project with the Food Bank, Better Health Partnerships, CHW Hub, and us. And we, as a part of one of the intervention arms, these are for food insecure pregnant individuals who are attached to a CHW, and one of the arms is that they're having food delivered from the food bank, and another one is they're getting a financial incentive, as well as the CHW being trained on this. And so we're going to get a chance to see how community health workers will use this. Eventually, we will then begin in that process, we'll be able to evaluate the use of it inside that study. But then the next part of this is to really launch it, and I'd love to get feedback from all of you on, like, you know, whether it's trainings, what we need to do to get this out and get it used by folks like you in the audience. Okay, so that's it. I'm going to stop my sharing. And then let's make it big. And I think we can open it up.
Yeah.
Whew, sorry, that was a whirlwind.
That was fantastic. There are questions starting to roll into the chat. And again, if anybody would like to unmute to ask a question, just raise your hand. I'll go ahead and share off the two that are in the chat, Elaine, just so that you can perhaps provide some answers to these. First is, our stores that accept produce perks
Yes.
highlighted in the map. So this is a nutrition incentive program that aligns with SNAP.
Nope, but that has been on our list, but that is a great, I'm going to take notes while we're doing this. And Laura and my team, if you guys could also help me take notes with this too. It is not, it is on the, when you go to the farmer's market, it does tell you that it, you know, either it takes SNAP and also whether it has produce perks, but no, not in terms of like the Daves and things like that. Is that I'm assuming that's what the questioner is asking.
Could be. I don't know, Abigail, if you want to come up,
Abby.
ask anything else.
No, that was my question. I work on the grocery store implementation evaluation, and it's such a cool program, especially being a dietitian. One of the biggest issues is just being able to purchase the food once you get there. So it'd be a cool add-on.
Yes, very much so. I will be in touch. Thank you.
A question from Alicia Thomas. Is there going to be an app? And do you see consumers using this?
Yeah.
And do you have pricing ranges at each place?
Okay, one at a time.
So is there going to be an app?
Yes and no. So I think that I mean, Matthew, I think Matthew's on too. I think that the hard part is that the ArcGIS doesn't translate as well to the app as we had hoped, but I think it's a good idea. It is really small to work on an app, to work on the map inside the phone, but you can do it. So you can access it on the phone. But it's just a matter of how savvy I think you are. Because I think to develop it as an app that you could look at your phone, it would probably have to be a bit of a different structure than clicking on a map. Pricing, So we do have pricing, but we have not included it here because pricing varies so dramatically over days and weeks in some of these small stores. So, so currently it does not include pricing. So, but I think it's a good idea. I think it would be very helpful, even for just folks, again, helping other folks to know that, milk in one of those corner stores may be $5 a gallon versus, $3 at the Giant Eagle.
Mhm.
So, and then what was the third one?
Yep, there's another little one hidden in there. Do you see consumers using this?
Yeah, I mean, consumers could use it. I think where consumers might be most interested using it would be is how to link up to maybe some of the suburban stores or stores that are not in their neighborhood, right? But I think as we've, most people know what's in their neighborhood. They might not know what's in the store. If they, like, especially I think some of these stores that have gone through some of the interventions, they might not look any different from the outside, but a lot of things have actually improved inside the stores, and they might not be going back into them. So yes, I think it could be used that way. I think the place where the pantries, the one place that is more difficult to do is like with the food pantries in the mobile, we can put them there, but really because those change so dramatically that in talking with the food bank, that's why the phone number, if you click on any of those food pantries, it takes you to basically the Greater Cleveland Food Bank's phone line. And that way you can go to see what the hours are and things like that, because that changes so dramatically as well. But yes, I think it's more aimed for professionals to use it, but I don't see why it couldn't be used by anybody who would find it useful.
I'm going to ask another question, but before I do, I just want to encourage audience members to turn your cameras back on, and we can make this feel a little bit more like a conversation, and join us visually. The next comment comes from Ms. Tony Johnson, who says, I think community training would be great, particularly for the Healthy Eating Active Living group in Greater Buckeye. There are a lot of folks from Woodhill as well. Tony, did you want to add anything else?
I think so. Tony, that's a great idea. Please email me, okay?
Yeah. And then there's a comment from Rosa Hand saying great presentation.
No,
and that she would be happy to connect you with a couple of dietitian groups for expanding the word.
Yes.
Cleveland Academy of Nutrition and Dietetics, as well as the Greater Cleveland Maternal and Child Health Nutrition Committee.
That'd be awesome, Rosa. Thank you. I think that the faculty that are here from the nutrition department, I think that's the next thing too, is like, how do we also show it to even students, like, in the internships and that, like, how can we get it into the internship programs maybe so that they have access early on in their careers. Yeah.
Are there any other questions from the audience? Please feel free to take yourself off of mute and join the conversation.
And I would also like to also invite the team, if anybody, I see Matthew's on, Rachel's on, like those of you that have really been a part of this from the beginning, if you'd like to share anything about it, please do. Don't be shy. Matthew, anything about the app that you'd say about turning it into an app? Any comments about that part?
So like you said, it would be a bit difficult to get it into an app format. Like right now it's technically an app through Esri, but it's just an application that can be used on your computer, and there's a lot of layers on there. So pulling it up on your phone gets really complicated. The process to get it on something like Apple, like the Apple Store, is even more complicated. So someone with better development skills than me could probably do that, but it's not something in my wheelhouse to do and get it up on there. I think it would need a whole redesign too.
Yeah, I think so too. Yeah. Well, we'll see where it goes, right? If it gets used, then there's reason to go after more funding to see if we couldn't expand it. Anybody else? Any other comments?
There are a couple more comments coming in. Oh, Rachel, did you want to offer something?
I was just going to say, it is very exciting to have been involved in this project and to see the data come to life and like be an exciting tool that people are excited to see things and like really just get a better understanding of what what the food environment is like in Cleveland and get that tangible understanding to really see that, you know, we go out and collect this data, and this is the kind of things that it informs, educating folks about the food system and what is available and what it actually looks like, instead of just kind of talking about the concept. So
Absolutely.
very excited to see it
And
come to
Rachel,
life.
thank you for all your work in this too. And
Yeah.
Matthew too, all you guys. This has really been it's been a labor of love, and and it's exciting to see it come out. So we hope seeing the comments are awesome, because the more we can share this, the better. So I think, we're putting a marketing plan together in terms of how to get it out to folks, but I think maybe the place to start with will be some of your own comments. So please email me. My email, actually, Laura, do you mind just plugging my email into the chat? So it's
Yeah, 1 second.
Okay, so it's exb11@case.edu. Please feel free to email me. You can put Laura, you can put yours in too, or Laura, and we're happy to talk you through. Okay, and the data is shareable. We don't really we don't give the database out per se because of the way it's stored in that, but we do have the ability to have an agreement with anybody who would like to use the data for different purposes.
Yeah, and I just want to pipe in and say I've only been working on this for like 6 months or so, but it's already been so much fun to get to see this come to life and stuff. And I like to give the anecdote of when I showed this to my husband for the first time, and he was like, "This is so cool." He just spent like hours just like kind of plugging things in. So he's not related to nutrition at all. So it's a really cool feature, and I'm really glad that I get to work on it.
Thanks, Laura. I will say that I didn't do the best part of some of the other things. I just was thinking about this is that, it has the ability to print directions out. Like if you wanted to show somebody where this one store was, there's a print function in there that you can actually download a map and print the directions, walkable by, I think it's walking, by bus or car. Little more clunky maybe, but I think that there's ways to do it. But again, people typically know where things are. It's more about what's probably in the stores that are the most useful. Abby, what was that? That went by fast.
There's a question that I hadn't gotten to yet that asked if there was any intention to add days or times to the more regular pantries, not the mobile pantries in the system. And I think Abby's question follows on to that about connecting to the Aunt Bertha app.
Yeah.
Sure.
Yeah, so that's something that I know there are some people I think on from the food bank. We'll have to figure out how to do it because they have a map too. So like the question is, how do you, to integrate these? And it's hard to stay up on these. So you're right, there are a lot of permanent pantries, but those hours change too. So, but I'm glad you're asking because I think it pushes us back to saying, how do we integrate this information in a way that and keep it updated? Right. Yeah. Vivian, I want to say too, I saw your text before or your message before about nursing. Yes. So please reach out to us.
Yes, I saw some school nursing colleagues on, and I was just going to say, I hope that they will reach out. And then Catherine made a comment, and Catherine, if you're still on, I'm not sure, maybe Elaine, you know what the SRHC is for SRHC?
It's the Student Run Health Clinic.
Oh, hey, Catherine.
Hey.
Oh, hi.
Hey.
Okay, what was the question though?
No, it was just a comment that I'm working with them to encourage them to consider this as something they just did a needs assessment and for elderly, food insecure elderly.
Well, I was just going to say, Catherine, you're a good example of it. I sent Catherine the link and said, see if you can figure it out. And you came back and said it was easy to use, right?
Yeah.
So good. All right. Well, thank you all for your enthusiasm for this, because it spurs us on to just keep moving and really seeing what other uses could come from this. It's what the PRC is all about. And so we really do appreciate your feedback.
Absolutely.
I think you should include toothpaste, floss, and tobacco cessation products.
Okay, yeah.
I'm just telling you.
Well, yeah, there's something to say about that. I mean, they're in there in the store. If there were things that we really thought people would be very useful to know what were in these stores, we could, I mean, they can't be everything, but we could certainly add things to the list, right? Same thing like we've just talked about recently, like we do all the pharmacies, but we've been looking at the pharmacies as food retail. But if pharmacies by themselves, especially we're looking for, you know, if they have to pick up stuff, that could be a separate icon too. I mean, we're already collecting those, so it's not that hard. Okay.
Elaine,
All right.
I will reiterate, you know, when you said out loud that we have been doing this since 2012, which is, that means almost a full 10 years.
Yes.
It kind of made me shake for a moment. But I want to reiterate, you know, the PRC really has been committed to collecting data, not only collecting data, but finding ways to put it into the hands of folks who can really use it and use it in important and impactful ways.
Yeah.
And so please, if there are connections that you think would be relevant, I know that anyone on this team would be happy to talk with anyone on this call or anyone not on this call about how to make better use of this data. And just as Elaine said, as we get ready to, I did put a link into our chat earlier for our summer internship program. If anyone feels like they'd like to share that with someone you know, or just come and be an intern and be a part of this data collection. We've also historically worked with partners across the region, across the city, to add items to this audit to inform other work. And one example is that is the addition of a Tobacco 21 signage when Tobacco 21 policy was passed in the city of Cleveland to look for compliance. So as the suggestion was made, if there are things that would be valuable to add for the team to capture this summer, I think those would be helpful comments to hear as well.
Yeah. And especially if you know a young person really that this is kind of this would be a great experience for them. It's a great summer, they get paid. It's a great experience. So the internship, I think the internship applications are up, correct?
Yes.
Yes,
yes.
they are open. So
yes. And if you just go to prchn.org, you'll see on the on our website on the far right side is our training link. And you'll find a link to our internships, the application program as well as our current opportunities. And we expect to have a nice big group again this summer here in person in the center.
Yay.
Yes. All right. Well, Elaine, thank you again. Thanks
Thank you.
to you and your team for putting together a fantastic presentation. I would like to remind everyone that we do record this and make it available pretty quickly within the week on our prchn.org website. So if you'd like to share this recorded seminar with any of your colleagues or watch it again, you absolutely can. And a number of the pieces that were shared today in the chat are also included on our website under the Neighborhood Environmental Assessment Project. And then to close, I just want to remind everyone that we would love to have you join us in April next month on April 13th. For a seminar given by Dr. Craig Fryer, who was wonderfully able to join us today and I think is still here. And Dr. Fryer will be talking about moving beyond symbolic gestures, the respectful engagement of underserved communities in research. And Dr. Fryer will be joining us from the University of Maryland. Nice to see you, Dr. Fryer. I look forward to your presentation. And thanks again to everyone for joining us today. Have a great day.
Everybody, thank you all.
Erica, you have a quick second?
Yes, let me turn off the recording.